This is Dr. Caudill Miller. Today we're talking about Amiovig, and we've been doing a series on headaches. And Amiovig is one of the monoclonal antibodies that we use for migraine headaches, and this class of drugs has just been game changers. And we've not had any new classes of drugs since the triptans, which came out 10 to 20 years ago. And this has just been an incredible new group of medication we use for migraines, period. The monoclonal antibodies block CGRP, which is the calcitonin gene-related peptide. It's a very small protein that's very prevalent in the sensory nerves of the head and neck. And it's involved in pain perception. Levels greatly increase in migraine headaches. And CGRP causes vasodilatation, inflammation, and increased sensitivity. Remember we talked about migraines. They get a vasoconstriction, then a vasodilatation, followed by this release of chemicals and this electrical tsunami of energy across the brain. Well, the CGRP causes vasodilatation, and monoclonal antibodies like Amiovig block them. Amiovig's used for episodic migraine, chronic migraine headaches, and medication overuse headaches. So people that take too many analgesics, even Tylenol, we see people take 30 Tylenol a day or 30 Advil, they can cause headaches. So if you have over 14 to 15 headache days a month, this is a very useful drug. Amiovig, what's incredible, it's once a month, 70 to 140 milligrams once a month. It's almost like a birth control pill for headache. You take it once a month. Not many side effects. Injection site reaction is probably the main one. Turns a little red. Could be some pain, sometimes a lump or swelling. Your doctor can help you manage this. Constipation is a side effect that we see. Constipation is something that we've seen a little bit, not really much, but the CGRP receptors are also in the intestine. They're widespread in the intestine. There have been some reports of people getting severely constipated with impaction, even bowel obstruction. I have not seen this. I've not known a neurologist that's seen this, but I would be aware of this. It's one of those sort of weird side effects that can creep up on you. If your patients get constipated, you need to have them with their primary care provider work on this and then stop it if it gets really bad. The other side effect is a rare allergic reaction. Once again, we've used this drug a couple of years. I haven't seen anybody allergic to it. But, it's one of those weird allergic reactions. The only reason I bring it up is that right now with, COVID and all this stuff, people get these upper respiratory infections. They go get a COVID test and it's positive, whether that means anything or not. But this allergic reaction, it's in the face sometimes, itching, your eyes will swell, your face, your lips, your tongue will swell. You can even get angioedema, which is significant swelling in hands and feet. Sometimes rash, sometimes not. And so just warn people if they feel allergic, they need to come in. It doesn't happen right immediately. It can even occur after a month or so. Very few people discontinue Amiovig and just don't see it. Give it a try. It's one of those great medicines that you could give a try. Another big advantage of Amiovig is it doesn't cause medication overuse headaches, so you can go on it and it won't cause them to have headaches. So that's Amiovig. And, like my channel, make some comments, subscribe to my channel. More later.